I'm Courtney Wagner, and this is In the Game. I'm here with orthopedic surgeon Dr. Michael Adams of the Jacksonville Orthopaedic Institute. Thank you for being here today.
Thank you for having me.
So you're a pretty worldly person. You've lived in New Orleans, you've lived up north in Jersey, now you're here. What kind of started that whole journey?
Well, I first moved down to New Orleans to do my residency training and kind of fell in love with the city. And then being a Navy guy, we moved around a lot. We were in South Carolina for a while, been in Panama City, now Jacksonville. Just kind of the military thing. Fell in love with the coast and decided that I wasn't going to leave Florida. I had to stay somewhere near the coast.
I was going to say, what has been your favorite place out of all? Because you've lived in some very fun, lively cultures.
We like the Gulf Coast a lot. You know, the water and the sand's kind of hard to beat, but Jacksonville has a lot more to offer, has a lot more cultural things for us to participate in. Obviously has our professional sports teams like the Sharks and the Jags that we take care of. And so professionally, this is the place for me.
Absolutely. And I love the fact, too, you're taking the best care of these professional athletes, but you were a D1 college athlete yourself.
I was. So that you know, what kind of really first interested me in orthopedics when I played Pop Warner football, I injured my knee back then. I remember going to the orthopedics office and saying, wow, this is what I'd really like to do for a living. And everybody aspires to do in professional sports. And I knew maybe that was something that I would like to do, but the chances of being able to get there was probably pretty small. So this allows me to keep that dream fulfilled, where now I participate with professional athletes just from the other side of the ball.
So you played D1 college football at Brown. Tell me about that experience. How did you get recruited? What was the experience there while doing med school?
I did. So it was a great experience. You know, playing college football even in the Ivy League is something still that I'll cherish forever. I made some good relations there. In fact, one of my classmates who I played with is the head coach over for the Texans now, Billy O'Brien. So, you know, we always get a group of guys together when, you know, he has games and they come and they play the Jags. So there's good linkage and interaction there. And that's something, and that's a relationship that you do foster for entire life. You know, 20 years later, we still talk to people that we were in college with. But I enjoyed being a student athlete. You know, I did want to play college football, but I knew at the same time that my motivation was to go to medical school and eventually to take care of collegiate and professional athletes. So I got to do both in college. And then when I went to medical school, I played rugby. So we continued in the kind of contact sport arena there, sustaining a few injuries. So I got to be, you know, close up with the orthopedic side of things as well from early on.
And how was it balancing, you know, some of the hardest academic material and then playing at such a high level of sports? How did you manage that?
It's not an easy thing to do. I remember when I was a kid, my dad would tell me that football was just another extension of the classroom, and truly that's what it became. You know, we had our academic load, and then on top of that we had our athletic participation, and so it would just add hours to the day, and you had to be very good and on top of things. You know, it's not like some of the bigger schools where you could just slack off on classes and get by. I mean, you had to do both, and nobody was going to cut you any slack on anything.
Exactly. And you obviously, you know, you worked so hard and you did accomplish all that. And now you're working with the Sharks and accomplishing your dream. What is your day-to-day like? How does that feel? What are some of your day-to-day activities you're doing?
Well, it does add a little bit to your day-to-day because you're constantly getting calls from your trainer. I think we have afternoon clinic today, and we have another 4 or 5 guys that are added on to our normal patient schedule because of injuries during games or because of pre-participation physicals that we constantly have to do, especially in sports like football. There are a lot of injuries, but I mean, all sports have that, but certainly, you know, with the Sharks, we do see that a lot, and it just adds to your normal patient load. So I think it's just basically an extension of what we got used to when we were trying to play sports and do classes. This is just doing your job and doing further on top of that. So it just comes with the territory.
Sure, still all the multitasking, just with different elements now.
Exactly.
And how long have you been with the Jacksonville Orthopaedic Institute, and what to you kind of stands out most about this organization that you have really, you know, embraced yourself in this?
Well, I've been here over 2 years now. March would make my 2-year mark with them. I think it's a fantastic organization. It's very well run. We have over 30 physicians that span the gamut of every subspecialty in orthopedics that you could possibly imagine. We have our non-operative doctors. We have specialists in sports like myself and shoulder. We have our spine specialists. We have our joint replacement specialists, our foot and ankle specialists, our hand specialists. So anything that possibly somebody could need from orthopedic surgical perspective, we can cover that. And we cover all the professional teams in town. So the soccer team, the football teams, we have all of our big high schools. We take care of JU. So we kind of take care of everybody that needs to be taken care of from the athletic side of things. But we also provide good community outreach. We have good participation in a lot of the charity events. Last month I covered PAL boxing. So, you know, things like that give back to the community, and that's a big part of what JOI is all about, is giving back to the community and providing impeccable service to Jacksonville from the orthopedics arena.
Absolutely, and I think that is the thing that really differentiates you guys so much, is how much you care about your patients, and it's almost, you know, a family type culture with your patients. And I know one of your many specialties is shoulders. Tell me a little bit about, you know, patients who would fall under that category, who you specialize with.
You know, there's a lot of people that fall under that category, and some of them are just people that, you know, do weekend sports and have minor aches and pains, and we help that with an injection or some physical therapy, part of which is covered within our JOI family. And then some of that requires surgery. You know, not everybody that requires surgery on their shoulder is a professional football player. Most people are just, with time, parts wear out, they get rotator cuff tears, they get arthritis. They sustain injuries and car accidents and falls, and those are all things that we can take care of. And a lot of times people like me who have that interest in taking care of things, doing minimally invasive surgery, are able to get people back quicker and avoid that long, you know, protracted recovery that you have with more open surgeries. So you know, we like to take care of everybody. We do see even pediatric patients. So we have people that run all age ranges from, you know, teenagers all the way up until 80s and 90s.
That's interesting. So really anyone could be a candidate for
sure,
this.
absolutely. Anybody could be.
All right, and speaking of other things you're great at, you just got credentialed for the Mako partial knee surgery replacement. That's a really big deal.
Right, so Mako's very exciting. Again, that's, you know, the way that not just orthopedics but medicine in general is moving to where we decrease the morbidity to the patient. So we decrease the incision size, we decrease the harm, we improve the ability to be more accurate in performing these surgeries. We use, in that situation, a robotic assisted device to help us make and form the knee so that we're able to do the surgery more exact than we could just by naked eye alone.
Sure, and is that, would you say, does it make it a little bit less invasive of a surgery, or is it still kind of the same protocols?
It makes it less invasive in as much as you do less damage to the knee to do the replacement. So the incision gets smaller, the recovery is quicker, and overall, you know, if you only have to do a partial knee replacement, it's a lot less damage to the knee than doing a complete replacement. So it preserves more of the natural anatomy of the patient, and that's what we're always striving for, keeping your natural tissue there without putting in parts that are going to wear out. And if we can do that, then we achieve something that allows somebody to have a successful surgery that's going to give them a longer lifespan than it would be if you're just putting in artificial components.
Right, and that's great to hear that you all are utilizing this technology and you yourself will be performing it.
Yeah, it's great. You know, that's part of what puts JOI right at the forefront of orthopedic surgery and technology.
Absolutely. And my last question for you, since you are a New Orleans man, what are your hopes and predictions for LSU's upcoming season?
I'm really super excited, obviously, being a Jags season ticket holder, that we picked up Leonard Fournette.
Yes.
I think that's going to be a great acquisition for us. I really am excited to see him next year out on the field. Of course, I hope that the Tigers do well as well, but it should be interesting to see. Now that we have one of our own here in
Yes.
Jacksonville.
Absolutely. Well, thank you so much for your time today, Dr. Adams. We appreciate all you do with Jacksonville Orthopedic Institute in our community.
Absolutely. Thank you very much for having me.